Hey guys, so we're going to talk about prime consideration. What is prime consideration? Always remember, if you suddenly find yourself labeled as a cancer patient, is the result of every single decision by your doctor going to saddle you with the highest number of billable drugs and procedures in the shortest amount of time? Always ask the question first. Is this a coincidence? Just try looking at it from that perspective and see if you can put the pieces together. Your health, comfort, safety, overall long-term well-being, healing strategy, it's not usually factored in. At least consider delaying biopsy until some visible, perceptible health change warrants such an invasive and potentially carcinogenic procedure. What's the worst that could happen to you by doing that? Few people die of cancer. Most die of the cancer treatment. That's the far greater danger statistically. That is the far greater danger statistically. If you have cancer, guess what? Guess which system is the most important to you at this time? More than it's ever been before in your whole life. Your immune system. Your immune system. Guess which system suffers the most from chemotherapy and radiation? Right again. So, the one time in your life you most need it, your immune system will be weakened by those therapies. Billions of free radicals destroying your cells. That's what the word cytotoxic means. Billions of free radicals destroying your cells. So that very same immune system that we are so dependent upon to heal our bodies is now being compromised and weakened by the therapies. That the very same immune system that's supposed to help build your body back and restore it to its, natural state is being compromised and being weakened by these therapies. A study in the Journal of American Medical Association of 223 patients conclude that no treatment at all for prostate cancer actually was better than any standard chemotherapy, radiation, or surgical procedure. Unlikely the statistics would be any different today since the recommended procedure have not substantially changed. Basically, they're just saying that for the prostate cancer, it was actually better than any standard chemotherapy. So back the treatment before. It's scary. I did surgery. I had the surgery. Am I out of the woods? I sure hope so, because I'm doing everything that I need to do to keep my immune system strong to help me to continue to make sure these free radicals, these toxins, do not re-enter my body to cause the same problem again. People look at me and say, okay, so, you're healed or you're okay now and you can go back. Back to what? Like, really? Back to what? Back to eating the garbage that the man has put out there for us to eat, to keep ourselves sick so that they can fill us up with drugs and bill us and make money? I hate to think of it this way, but look like the root of all evil is money. Unless you are using it in a way that helps people to, live a very prosperous and fruitful life, this country does not promote that. It only promotes work yourself to death, to pay these bills, to get sick, to pay them back now, give them some more money through your medical insurance, and then eventually you get too sick and now you die, I just finished talking to I don't know if she's not a friend. I met her and I'm always sharing. So I met the security guard and we were talking about her sister. And her sister, the doctors gave her X amount of time to live, and then she lived past those months, and unfortunately, I just feel like she needed the help and support and this information. But now her organs started to collapse. You know, they're not functioning properly, and she's gradually just really breaking down. You know, and it's very disheartening because there are ways that we could take care of our body. We have to educate ourselves, people. We have to be informed. You know, when I was in Mexico going for treatment for this breast cancer, the things that I learned, I just did not want to live anymore. Not that I wanted to just die, but I wanted to do it my way. I'm going to do it my way. I'm going to do it naturally. And if it doesn't work and I die, then I prefer, I'll be happy. I don't want to depend on the doctors because they are not taught nutritional healing. They're taught drugs to get paid, to bill you and keep us just sick enough so they can get as much money as they can get out of us, you know, the medical system and pay their bills. But we're struggling. We're going through all of this just to get sick and die and not being educated. All right. Love you all. Take care of your health. If you like this video, please give it a thumbs up, share it with a friend, and I'll see you in the next video.